Are you allowed to use heat after your knee replacement? I know a lot of you guys are using ice to help with swelling and pain control, but I often get questions about heat. So what do I recommend? We're going to go over that in today's video. For those of you who don't know me, my name is Dr. Samantha Smith. I am a physical therapist that specializes in knee replacements. Follow me on Instagram, TikTok. You're here on YouTube. Please subscribe. And I also have a Facebook group dedicated to supporting you guys through this journey. Just go to Facebook and search Succeed with Your New Knee. Also, one more thing, I do have a website completely dedicated to knee replacement tips and tricks and recovery. I have 4 courses that I instruct. I have exercise classes for you guys, so just go to succeedcourses.com. You'll see everything there. But let's get into the topic of today's video: heat versus ice. When should you use ice? When should you use heat? I will tell you everything that I recommend. I always get asked what is my favorite ice pack or heat pack, and my favorite one is Active Wrap. So this is the brand. It's called Active Wrap. You can go to activewrap.com and order these ice packs. These are professional grade ice packs. They stay cold the longest. I actually did an experiment to see which ice pack stayed coldest the longest. You can go to my YouTube and see that video, but I tested out, I think it was 9 different ice packs, and the Active Wrap just blew it out of the water with all the other ones. This one stayed coldest the longest. I think it was up to 45 minutes this thing was staying cold. Some of the ones on Amazon got warm within like 7 to 8 minutes, and that's really frustrating when you need ice relief. Switching out ice packs every 10 minutes just is not doable. You would need to have 5 different ice packs in your freezer to kind of cycle through them throughout the day, because it does take time for them to refreeze. Generally 1 to 2 hours, you want to keep your ice packs in the freezer before you reuse them. So I really recommend Active Wrap if you need a great ice pack. Again, professional grade. You can also put this in the microwave and use it as a heat pack as well. So let's go over when you should be using ice and when you should use heat. So heat is used on the muscles itself, and ice is used directly on the knee joint. So ice is used to reduce pain and to reduce swelling and inflammation. Heat is used to reduce pain, but also to relax the muscles. So what happens is your nervous system works in a certain way. There's different nerve fibers for different sensations. So the heat and ice nerve fiber, which is our temperature nerve fiber, is a little bit faster to the brain compared to pain. So that's how ice and heat work for your pain relief. It's called the gate theory. All that happens is when you have pain, you put ice on top, and that nerve fiber gets to the brain before your pain does. In a sense, that's what's supposed to happen. Of course, you're still going to feel some pain when you put ice or heat on your leg, but that is what the gate theory does. It does interrupt the pain signal. Where does the heat go and where does the ice go? So heat's going to go directly on the quad muscle. You can put it on the top if you're having quad pain. If you're having hamstring pain in the back of the leg, you can put it there as well. A lot of people will ask me, what about behind the knee? They have that aching pain behind the knee. You can try heat behind the knee and see if it does relax those muscles back there. There are some tendons in the back of the knee that get really tight and irritated. You can try heat back there to see if that relaxes them and gives you some relief. Generally, we want to be using ice directly on the knee joint, above and below. So ice is going to go right here with the Active Wrap. You're going to put it right on top. This thing wraps all the way around. There's different sizes of these Active wraps on their website, so just make sure that you get the right size. So this thing wraps all the way around, and it also provides compression, which is really great for swelling control. So again, really great ice pack for that reason. So ice goes directly on the knee. Heat goes directly on the muscles to help them relax. I know another big question that comes up is my therapist doesn't want me using heat at all. So I would just kind of challenge them and ask them, why can't you use heat? Because one of the best heatings to the muscle is exercise. And I know you guys are probably doing the bike, you're doing all these other exercises and movements. So if you're heating up the muscles already, with exercise, why can't we put heat on the muscles to help with pain relief and relaxation? So just ask them that question. That's always my philosophy with some of these things. Of course, there's pros and cons to everything. Some people might not tolerate the ice and like the heat more, and vice versa. Some people just might have excessive swelling in their leg, and maybe heat isn't recommended. It's not recommended to use heat if you have an active infection. So there are different pros and cons or contraindications with heat versus ice. So definitely follow your physical therapist's advice or your surgeon's advice when it comes to ice or heat. So thank you guys for tuning in today, and I'll see you guys again in my next video.